Okay, sorry about that. My battery ran out. So anyways, so this is a normal cervix. And I think you guys heard me say that when they do a pap smear, they put a scope into the vaginal canal and open it up, and this is what they see at the end of the vagina is the cervix, and that's the opening that goes up into the uterus. So this is normal, and then they put like a long Q-tip kind of thing, and they scrape that, and then they send that to the lab, and then the lab will test what kind of cells are growing in the cervix. This is a carcinoma in situ, meaning it's not a cancer yet, but it's starting to convert. They're seeing some dysplasia, some abnormal cells. This is a carcinoma in situ stage 2. You can see they're starting to develop some white, just some thin, milky malignancies starting to grow. This is a stage 3, stage 4, and now we have invasive carcinoma. This is a very significant malignancy. So if they catch it early enough, if they get the cells early enough, they can do what's called a colposcopy, like a cone biopsy, where they will just take that section out, like just a small section out, and then usually that's all they need to do because they get it early enough, which is why it's so important to get annual pap smears, because if they get it this early, then it's just a little cut out and no big deal. As it's going on further and further, you can see the inflammation starting, the invasiveness is starting. Now this is like the heavy bleeding. You can see that's why it's going to lead to some heavy bleeding. If it gets this far, now we're looking at, sometimes a complete hysterectomy, which is horrible, especially if the person is young. So you got to be really, really vigilant about getting really good pap smears. But again, if your patients who are in high risk, your patients who might be in low income, maybe having to work as like in the sex trafficking industry, they're probably not getting their good annual care, and unfortunately then they come in and it's already too late, which is why we in healthcare need to help promote really good screening, really good healthcare for these women. So who should get the pap smears? People who get pap smears, and pap smears are just exactly that, in order to screen for cervical cancer, needs to start within 3 years of the initiation of sexual intercourse. So again, if you've got these young girls coming in, they're 16 years old, and you get a sexual health history and find out they've been started having sex at age 13, 12 or 13, they probably need to have, not even probably, they do need to have a baseline pap smear. But for sure at 21. So even if somebody has not had sexual intercourse, if they're still a virgin, they should come in and at age 21 start getting a pap smear to just find out if their cervix is healthy. Very painless, inexpensive, really easy method of detection, excellent way to prevent cervical cancer. So this should be done, for all women, even past childbearing years, because like I said, sometimes it takes cervical cancer a while to show up. Okay, so cervical cancer, easy to detect, easy to treat if you get it early enough. Not the case with ovarian cancer. Ovarian cancer is extremely aggressive. It is on the same order as pancreatic cancer. One reason is that the symptoms are very vague. We don't have good diagnostic. You can't screen for it like you do with cervical cancer. It will cause like some bloating, discomfort, very similar to menstrual problems like every woman's had their entire life. So the symptoms often will go unrecognized, or the women don't seek treatment like they should. Or even if they go in and seek treatment, the physician might treat them for something else, like maybe pelvic inflammatory disease, dysmenorrhea, meaning difficult periods and stuff like that, before they really can do an ultrasound or CAT scan and find out that the female actually has ovarian cancer. By that time, it's often too late. Usually, they will do a total salpingo-oophorectomy, complete total hysterectomy, take out the ovaries, followed by radiation, chemotherapy. But again, very aggressive. Life expectancy once ovarian cancer has been diagnosed is very short. That's a horrible one. The other thing is the anatomical disorders. Like I showed you in the very beginning, there are a lot of structures right at the bottom of the pelvic floor for women. When you see this word cele, C-E-L-E, that is a protrusion of an organ into another organ or out of the body. This is a cystocele. A cystocele, cyst is like, it means bladder, and a cystocele is just the downward displacement of the bladder. So here's the uterus, here's the vaginal canal, and here's the bladder. The muscles that hold this bladder in come right along here. Well, if you have an obese female patient, a female patient who's elderly, a female patient who has had a ton of children, because the more children they have, the more this stretches, you know, and shrinks back, stretches and shrinks back. And what can happen later in life is the entire bladder then can come through. So what's happened is that it stays up here, it goes through the path of least resistance, and can actually, what you're seeing right here is the bladder is dropping down through the vaginal canal. That's called a cystocele. And we have to fix that surgically. So you've got to go in, you've got to put the bladder back up in there, and then they will tighten that up, and that is a repair of a cystocele. They can also have a rectocele, where this one over here is a rectocele, where the rectum comes bulging through there, or where the actual uterus itself comes bulging through, and that's what this structure is. It's coming through the vaginal canal. The this one is the rectum, so you can see like that's the actual rectocele bulging through into the vagina. And then sometimes what you can have here is when these start collapsing down, is that you can actually get fistulas, which because they don't just slide down, they're happy to be there. You usually have some tearing in here, and that's when those fistulas can occur. And then you start having, like, you can get an infection in there, because obviously you've got some E. coli and stuff. So one, you got to identify, you got to figure out what it is, who's at risk for it, and how do you fix it. And these all have to be fixed surgically. You don't have any medicine or things. Kegels exercises early on will help prevent some of these things. If you keep those pelvic floor muscles really tight, that helps prevent that. So that's what you need to know for female reproductive. Then we're going to talk about breast cancer in the next one. So stay tuned.